Hi, my name is Todd Moldawer, and I'm a fellowship-trained orthopedic spine surgeon at the Southern California Orthopedic Institute, specializing in disorders of the spine. Today we'll be talking about disorders of the cervical spine. The cervical spine consists of 7 cervical bones called vertebrae, which connect the skull to the torso. Surrounding the bones of the spine are muscles and ligaments which support the bones and help us with our daily activities. Common disorders of the neck or cervical spine can be divided into 3 categories: soft tissue problems, bone and joint problems, and nerve problems. The soft tissue problems are usually called cervical strains and can be due to sports injuries, car accidents, or just the normal activities of daily living. Bone and joint problems are usually more serious and may result from car accidents, falls, work injuries, and over time, arthritis can also affect the cervical spine joints, causing pain, stiffness, and occasionally cracking or popping sounds. The most severe cervical spine conditions affect the spinal cord and the nerve roots, which travel from the neck into the arms. The most common cause of a pinched or damaged nerve is from a disc herniation or protrusion, and this can occur from an injury or through wear and tear of daily activities. More serious injuries or diseases which affect the cervical spine can cause damage to the spinal cord, resulting in partial or complete paralysis below the neck. The symptoms associated with cervical spine conditions can vary from mild aching to severe pain and spasms. If nerves or the spinal cord are involved, numbness, tingling, weakness, or even paralysis can affect the arms and rarely the legs. In severe cases, it may also affect control of bowel, bladder, and erectile function. Patients should seek medical attention if they have neck pain or soreness that lasts more than 72 hours, or if they're experiencing any symptoms such as weakness or numbness into their arms or legs. In order to establish a treatment plan, an accurate diagnosis is essential. This requires a thorough history and a detailed physical examination, which should include range of motion measurement, strength testing, reflex testing, assessment of sensory function, and a palpation of the neck to identify areas of tenderness and spasm. For non-surgical conditions, exercises, physical therapy, activity modification, and occasional medications are recommended. In some instances, cortisone injections can be very helpful and can avoid the need for surgery. There are many surgical options for serious cervical spine conditions, including repair of disc herniations, fractures, severe arthritis, and instability caused by trauma or diseases. A successful surgical outcome requires a precise preoperative diagnosis and a thorough understanding of the pros and cons of the various surgical procedures available. The most important concept in providing postoperative instruction to a patient recovering from neck surgery is to fully understand the nature of the surgery, the anticipated physical demands of the patient, and other relevant medical conditions which may be present. In other words, our postoperative instructions are individualized to address the patient's condition and to ensure maximal functional recovery as soon as possible. Choosing a physician for surgical or non-surgical care of a spinal condition is a very important decision, and patients should take the time to determine the background, experience, and professional reputation of the individual to whom they entrust their health care. The physicians of the Southern California Orthopedic Institute have been providing the highest quality of medical care since 1979, and we're known nationwide for the outstanding care we provide and the many surgeons we've trained over the years that are practicing all over the United States. To learn more about cervical spine conditions and cervical spine surgery, log on to our website, www.scoi.com.